There is a minimally invasive procedure for some patients with lung cancer, and the first physician to perform it in Nevada is here with us this morning.
Dr. Samir Rehman is the cardiothoracic and interventional radiologist at Valley Hospital Medical Center and has more info for us all. Good morning.
Good morning. Thank you for having me.
Of course.
Thank you for being here. Now, we are talking on the topic of minimally invasive procedures. So let's start off with the baseline here. What is thermal lung ablation therapy?
Sure. So lung ablation is a procedure in which a needle electrode is directly placed into the tumor using imaging guidance. So generally, we use CT scanners to exactly guide the needle from outside the patient through the skin into the lung of the patient and into the tumor. And using that needle, we deposit energy, which could either be heating energy called microwave energy or freezing energy called cryoablation. And depositing that high temperature or low temperature energy causes the destruction of the tumor cells. So that's what entails the procedure.
All right. I don't know if it's just me. I hear needles and I hear pain, but is ablation, is it a less invasive procedure than open heart surgery when treating primary or metastatic lung cancer or for treatment?
Great question. Yeah, certainly. So there's no cutting or opening. There's a small 5mm nick or incision through which we precisely place the needle into the tumor. And the recovery is pretty quick. Most of our patients go home the very same day or the next day after the procedure.
Yeah. Oh, wow. Talking about this recovery, is lung function itself better preserved after ablation than surgical removal of the tumor? And why is that important?
Certainly. So most of our patients who get lung cancer, as you know, are cigarette smokers with already compromised lung function secondary to emphysema. So lung function is really important. These patients have reduced lung capacity to begin with, and taking part of the lung out further compromises the lung function. So this procedure has an added advantage that you freeze only the area where the tumor is and preserve the healthy lung tissue, which is very important in patients with COPD or emphysema secondary to cigarette smoking. And that's one of the drawbacks when you get open surgery or radiation therapy, that it destroys normal healthy lung tissue or removes that normal healthy lung tissue and compromises the lung function even more. So this procedure primarily preserves the lung function.
Right. How about if a patient has a recurrence of the tumor? Can they come back for the same ablation treatment in the same area?
Absolutely. That's another advantage of the procedure, that it's repeatable. So you can perform re-ablation again if the tumor comes back. And some of the patients that are referred to me are after radiation therapy who have tumors come back, and I would go in precisely matching exactly where the tumor is and freeze that area.
Right.
Yeah. As far as the other benefits, can you share a bit more, and are there others that you'd like to share about thermal lung ablation treatment for that early stage non-small cell lung cancer and medically inoperable patients as well?
Certainly. The first and foremost is the lung preservation, like you mentioned. The second is it's minimally invasive, so there's no cutting opening. The recovery is very fast. Most of our patients go home the same day or very next day after the procedure. The third is it's repeatable. If you have tumor come back, you can go in again and ablate the tumor again. There's no compromise to the existing lung tissue. Another great thing is that you can often combine it with other therapies. In certain cases, when tumor sizes are larger or more advanced disease, you can do a combination of therapies. You can do ablation and radiation together. Also, it does not impede patients from continuing their chemotherapy if they're on chemotherapy for arresting the tumor growth. So these are some of the advantages, and also it's a very low-risk procedure. Some of the complications can be immediately dealt with. If there's a lung collapse, we can put a chest tube, and the recoveries are generally very fast.
Well, Doctor, thank you so much for coming in today. Obviously, these advancements have made your life and obviously patients' life much easier. So thank you for sharing with our viewers at home.
Absolutely. My pleasure.
So for more information on this procedure, as well as an overview of all cancer care on the premises, just visit valleyhospital.net.